I think there is a shift in our culture that is good in that direction, right? And I'm focusing on going to therapy because I do think a lot of the work is psychological work, and you can't just learn it in a self-help book.
Hi, everyone. Welcome back to my podcast. I'm Dr. Drew Ramsey, double psychiatry episode. I'm really excited. I've got a really special guest, a friend, a fellow psychiatrist, and a real favorite psychiatrist of a lot of people. Dr. David Puder is here with me. He is in private practice in Orlando, Florida. But the way that we know David and why David's really special and why I wanted to have you on early is David hosts the Psychiatry and Psychotherapy podcast. He is posting episode 185 later on today. And I wanted to have him on early, one, to give me all of his tips, but also because, David, you have interviewed so many of the top folks in our field. And when I think about brains that after residency have just kept learning and being curious and interviewing some of my favorites, he had Nancy McWilliams on, who is just one of our I think, best teachers. Her books are so clear, and she's so empathic and thoughtful about the practice of psychotherapy and helping clinicians get better. So David, welcome to my podcast, and it's a real treat to have you.
Yeah, thank you. It's a pleasure to see you doing this. I'm glad you're doing it. Get some of your wisdom out there.
Well, you've been encouraging me for a while, and I've really appreciated it and really enjoyed our friendship and our friendship growing throughout the pandemic. David's one of those folks who kind of helps keep me together, even though you're a little bit, in the periphery of each other's lives. It's just been nice. It's been nice to feel your support, but also to see you out there as a psychiatrist, making content, thinking about how do we better educate the public? How do we think about these ideas? I love your Instagram. And I want to start with you as a rower, because one of the things I love about the Instagram is David has a lot of interesting aspects about his life that I don't really know much about. But one is, in college, he was a rower. And when he moved to Florida, he got himself a little scull, little single, I think they're called sculls, one of those fancy rowing boats.
One. Yeah, it's a skull.
And suddenly you see David out on the water, 5 a.m., starts posting some of a lot of his workouts, a lot of details. And so you are a really, I wanted to have you on early in part because your mind is really interesting. You're just doing so much, the way that you think. I remember when you started eating chocolate, you sent me this graph of like everything you were eating, how many grams of chocolate you'd started consuming, what you felt the changes were, and things like, you had a bunch of metrics. And I adore that about you. And so, but I wanted to get into your rowing first.
Okay.
What?
So yeah,
tell us a little about you.
I was a football player, wrestler in high school, had the least unathletic parents you can imagine. My dad would show up to football games and say, "Wow, your band was really good." But I was a big football player, like MVOP.
Really? What position did you play?
I was a tight end. Yeah. So I contemplated playing football in college, but I thought to myself, it's going to take too much time, and I really want to go to medical school. So I decided to row. And it came to me one day in high school, and I'd never seen a boat before. And so I decided to email some coaches. And so this one coach, Coach Bond, had me out. And I think I was the first applicant to his rowing team that had ever jumped into a workout. There was this like land workout. And of course I was like guilty that I would not working out for wrestling. So I just jumped in, started doing pull-ups with everyone, started doing all their land exercises and stuff. And so impressed the guy enough that he had me come out and row for him. And, this was like Cal Berkeley at the time had just won 6 national championships in a row. So it was like the most intense environment for rowing you can possibly imagine. Like people on my team.
Just so I understand this, it's the most intense environment for rowing for rowers. You yourself actually at this point are not a rower. You've never gotten in a boat. You've never gotten in a scull. You just saw one in high school. And I appreciate this. You thought it looked cool. And didn't want to do football. And so you're at Cal Berkeley and you wander on down, find the team, start doing pull-ups with them.
Yeah. And so I just walked on, and it was like, I was so naive. Like, you don't know what you don't know, right? I'm just like, yeah, I'm going to row. It doesn't look that hard. It's actually it's like swimming. Like imagine walking onto a swimming college team without ever swimming. It's like people like Václav Vošáčka had already been to the Olympics. He was a freshman on my team as well from Czech Republic, and he was, rowing since he was like 5, right? So like it was just an incredible group of guys, but the coaching was just top shelf, and that's what I looked for. I think that's why I did it there, because when I saw the excellence, it was just attractive.
So like a framework to really hone some athletic skill and also I think some mental fortitude that it seems you have.
Yeah, a lot of suffering, which I don't know if I love suffering, but I just find myself.
I don't know. I mean, you want to tell us a little bit about that? You've built yourself your own personally designed, and this is, again, your mind is so fun to me, personally designed cold plunge with recirculating water that he's going to change the design because of where the cold water shoots. I won't mention that here on this podcast. But besides that, you do seem to have a little, I don't say intrigue with suffering. I mean, rowing is suffering. One of my best friends is a psychiatrist. Dan was a big rower. A couple of my patients were big rowers. I mean, that is a sport that really is, paying very close attention to exactly how much power you're putting out. And it is a grueling sport.
I think looking back, it was actually very helpful for my brain, because I think it really did just take me out of the stress of school. So like I remember
you're suffering, and so what do you mean though? I'm a little. You're sort of insinuating a little bit that like the rigor, the camaraderie, but also the suffering are good for you.
Okay, so I think that doing something hard progressively over time is good for the brain. Yeah, I think that's a pretty.
We should double shrink thumbs that one up. I mean, I totally I agree with you.
And I mean, it's like things. Like psychotherapy, I was just talking to a patient today, and I actually made the rowing analogy. I didn't know you were going to ask me about rowing, but I was like, it's kind of like rowing. Like it's really hard. I'm your coach. I'm watching you do something that's really hard, but it's actually like, it's really beautiful that you're putting in the work and you're aspiring to change your attachment style and change the way you connect to people.
Well, let's get right into the idea of psychotherapy, because you've spent so much time interviewing folks, and then your podcast is great because you have these really wonderful PDFs. I think you have some medical students that help you out. I hope so, because I'm just going to be overwhelmed with envy of your productivity. But I think the last PDF you had was like over 40 pages, just filled with info, studies, clinical perspective, tips. I mean, it is such an incredible resource. And so I'm really curious about how you, with all of that knowledge, right, in fresh knowledge, and like a lot of us, right, we've been taught by some of these experts, we've read their books, but we haven't sat with them and interviewed them like you have. It makes me really curious how your approach to psychotherapy has evolved.
Yeah, I think that my approach to psychotherapy, okay, it's coming back to this rowing analogy. It's like when I started out in rowing, like I knew that this coach was like a really good coach, right? And he would say things that I didn't really understand, but I was like trying so hard to understand it. So it was kind of like that for like when I started to learn about psychotherapy from Dr. Tar, like when I was a resident. I remember listening to him, and this is a guy who at the time was in his like early 80s. He just passed away at 94. So anyways, he would speak in such a way where I was like, what is he talking about? And he had sat with people 3 times a week for decades, right? And so he had this kind of like implicit knowledge that when he talked, it was kind of like, okay, I don't really understand this, but I think there's something there that's really beautiful, on how humans connect, on how like humans grow. And so I think as I've progressed, because when I started the podcast, I was like about 5 years out of practice. And now I'm like 10, 11,
5 years out of residency.
Out of residency, yeah. And so I've like experienced a lot of patients in that time period, and having access to mentors is such a blessing. And it's like a lot of the topics I cover are topics that for some reason are interesting to me. It's very spontaneous. Like I think you're a J, you're a planner. I'm a P. I'm not a planner, like Myers-Briggs, right? So it's like
you're Myers-Briggs me right now. Oh my gosh!
Yeah,
okay,
I know you're a J. I know.
I'm a J. I'm a judger. That's like the whole point. I think I'm not a judge. I mean, the whole point is I'm not. I want a relationship to be a little bit unlike relationships in your life.
No. Are you?
People, like, I really don't seek in any way to pass any judgment on you.
Oh no, but that's different.
That's different. Not that kind of judgment. All right.
Okay. A J is like someone who's very structured. They have a plan. They execute the plan. They make a decision. They move forward. P's like to leave their options open. Leave the options to the last moment. A little bit more spontaneous.
I think I look like a J. I look like I'm a J, but I'm a P.
You are. Okay.
So, I mean, I've come into this interview, you saw me, David was here early. And, I'm kind of getting things together. I've got some questions.
I don't know. I see you as someone who's like very organized though, who like executes, who makes a plan.
We'll find,
writes books.
Thank you. Well, thank you. David, I want to, so your psychotherapy technique, to get back to you, has evolved. And I'm realizing for everybody listening, first, thanks for joining us. And I'm thinking about everybody listening and what they want to hear from you. And I'm guessing we have a lot of folks listening who aren't clinicians. And I think a lot of people wonder whether psychotherapy works and whether people actually change. And I was wondering your thoughts on that.
Psychotherapy works. It takes time. It takes more time than insurance companies want to pay for. It's like, it's going to take something. It's like, I read a study just yesterday, is like 20 sessions to get 50% in a clinically meaningful change, and like 50 sessions to get like maybe 75, 90% in a clinically meaningful change. So it takes longer than people want. And we live in a very fast-paced culture where people want instant solutions. And psychotherapy takes time, but the time is well spent, because the change is, when it happens, if it does happen with good therapy, it's life-shifting.
And good therapy, help us on, because I think some often we take a history. You and I are reasonably experienced psychiatrists, so often we're seeing folks where we're not their first psychiatric rodeo. Sometimes, but not often, where people have seen a number of clinicians. When you say like good therapy, like how can people better understand or assess that? Like, am I in a good therapy or not?
Do you trust your therapist? Do you feel connected with them? Do you feel they understand you?
Like Ron Daddy, my analyst. I love my analyst. My analyst has been with me since I was an intern.
Okay,
Ron,
really,
and actually, and he's. We've been talking a little bit as he's I don't want to say older, because I think about him as ageless, but I think the truth of the matter is he's 80 soon, and so the when you know someone that long and they also know you that long. I think it can be a little, I certainly think my therapy has worked, but I'm kind of curious your criteria in terms of when you're kind of assessing and asking somebody, these are the questions: you feeling attached? You feeling known? You feeling comfortable? And what about if I'm feeling those things, but I think a lot of people, they're saying that even if they've been in for some months, they're not exactly like a feeling either a change or a shift or what they hope for. And I was wondering what kind of advice you have for people to get more out of it, or assess whether they're with the wrong person.
Could they express that? What if they do express that? Could they look at that with the therapist? Could they look at that in a sort of a non-judgmental way of like, what is their goals, or what are their frustrations? Or, sometimes the frustrations are expressing the frustrations is a part of good therapy. It's like, I get excited when my patients are upset at me. It's like, okay, what is this upsetness, or where does this come from, or what does this mean, or what, how can we be curious about it?
It's so wonderful in the therapeutic, sort of this notion. I think of it sometimes like a feelings laboratory, where they're having these powerful emotions, both of us, the therapist and the patient or the client, and and to sift through and understand those, especially as you say, the kind of negative ones, right? I have patients I've worked with for years, and something will happen. Say, like, I just really don't feel I trust you anymore. I think when we're early being therapists, sometimes we get a little defensive, or take offense at that, or wonder what should we be doing differently to be more trustworthy, right? But then as you get more experience in the room, and you take a step back and understand, like, how did that happen? What's going on inside of this person I'm with, that suddenly, for all of my efforts to be, as trained as you can be, present on time, thoughtful, curious, that I'm suddenly, I've gone into the bucket of not trustworthy. Like, what happened inside their mind? What got triggered? It's you're right. It's such a kind of wonderful and curious moment in a therapy when that happens.
Right. Because normally conversations like that are inherently threatening. To talk about the interpersonal, to talk about what's going on between you and the person, and to create a space where that's like, not only is it safe, but it's a part of what's expected almost in the work together. It's like, yeah, we're going to look at these things that go on. And that's a new experience for a lot of people, to have that freedom.
Yeah, we're gonna, and also I think the part that sometimes people miss about psychotherapy, that Otto Kernberg quote I love. I'm sure I'll say too many times on my podcast, but that psychotherapy begins where friendship ends. This notion of, what are you doing that's different than me just talking to a friend? And that part of that is what we're discussing right now, this notion that you're in the relationship in a very different stance than a friend would be, with very different set of, in some ways, biases and information that is there to do something very specific that friendship in many ways isn't. So, David, I just want to pivot a little bit and think about tips you have from your mental organization. You see me as somebody who's a planner and very organized, and maybe there are some aspects of that are true. I have to be honest with you, that's not entirely how it feels. I mean, a little bit, especially now, maybe as I'm getting a little older, I do feel sort of and I've been drinking for almost 2 years now, and I think there's something about I notice I'm not using as many lists, and then I wonder, maybe I'm just forgetting everything, right? It's like I'm not even aware that I'm. So I should probably check with people in my life. But go ahead.
You said you've been drinking for the last 2 years?
No, I haven't been drinking for the last couple of years, and there's something about, I've also noticed I'm not like keeping as many lists. It's like my mental organization feels there's a more clarity and more of a through line, it feels like. But I'm wondering a little bit about like your mental organization and tips you have, because it feels like there's a lot going on in your mind, and your mind feels a little more highly organized than mine.
Really?
A little bit, yeah.
Should ask my wife.
I feel like you've got more spreadsheets in your life than I do somehow. And I feel no.
No, that's like a phase.
Is no one as well organized as we think? Is it that everybody is kind of struggling to keep it together in some way, and we have this assumption about the people in our lives we look up to, or maybe idealize a little bit, that they've got it going on in some way that actually doesn't really exist that much out there in the real human universe?
Yeah, I think you may be over idealizing me if you think I'm like some nirvana of mental organization. No, I operate in a lot of chaos. I really do. And I think what I'm able to do well is to recruit other people to join me in the chaos. And then hopefully we create some art together, So like, I do have medical students who work with me. And, I find them because they're people that reach out to me and they're passionate about a topic or just passionate about the podcast. And I'm like, hey, let's do a project. It's very spontaneous and see what happens, right? Sometimes they're home runs and sometimes they need a little bit more guiding, and that's okay. But I like most of the people I work with, and I don't know, I enjoy that aspect of it, the spontaneous mentorship, or finding
there's something spontaneous
about
it. I think it's also great for medical students, because I think so many of us in medical school and residency, the notion of being involved, especially publicly, in an ongoing conversation like this, really kind of putting yourself out there in a variety of ways is often frowned upon, and I think that's really damaged our field. That we've made mental health more elusive, mysterious, and judgmental than it needs to be. And so, I love
Really,
the idea that you have.
I don't really feel that. I mean, where do you feel
Tell
that?
me.
Maybe
I
I'm not
felt,
listening to the same people you're listening to.
well, I don't know if
But
it's
that's a
listening.
very
I think it's more the orientation, the classical orientation around self-disclosure, right? That not having really anything known about you is the way to be the best therapist and to be truly neutral and to have truly unbiased transferences in your room. So I think there's a history of that. I think it's because in part also creation of content is a narcissistic effort or viewed in that. And I say like the wrong definition of narcissism, right? That it's just in serving the self as opposed to the more, say, diagnostic kind of lack of empathy definition of NARP. But in that kind of more cultural, right? You make content and you're out there for service of the self, which I think there's truth to that. I mean, I don't, if you take pleasure in the self, part of that is doing things with it. But maybe that's kind of where I felt it. Maybe it's also because I write books about food in a field that really hasn't paid attention to or valued that explicitly. So
yeah, okay. So what I would say is, I think my experience was when I was starting, or when I was thinking about starting the podcast, was I have dyslexia, and so I learn by listening to things. And I could not find enough audio lectures of people teaching. Like there were not enough psychiatry books on in Audible. There wasn't enough. Like I went so far as like almost signing up for the Braille Institute, where like things are, where I could get audio access to it. But so I was like, I found these like lectures that I was just like totally captivated with, like Philip Resnick on like violence and stuff like that, but these were often behind a huge paywall. And so the public just did not have access to any of these conversations. And this is like top shelf level stuff, And so I was like, how do I get this stuff out there for free for anyone who wants to listen to it? Which is why none of my content is behind a paywall. And I don't think it will ever be behind a paywall, because I feel personally, and it's okay if you feel that, everyone's going to do their business differently. But for me, just to get it out to the most people possible, and like people in like third world countries, like who listen to the podcast, it's like, that's wonderful. Because I
love when I first talked to you,
that.
right as you were starting, and you really were it was inspiring to me because you were so clear about your calling. You're so clear about it. And I don't even remember in one of our initial talks, but you kind of were doing the order of magnitude calculation. If I can put a piece of content out there and I can help 10,000 clinicians understand transference or medications or insomnia better, then those 10,000 clinicians, they're going to see 20, 30 patients each. I'm helping thousands and thousands of patients with this information. And it was you had such clarity of mission. It was really inspiring.
And I think like, if I can get a world expert on someone on some topic who's been like, if you're listening to this and you're a world expert on some topic and you've been doing it for 30 years and you just don't have a mic, reach out to me and Drew. We'll get you on both of our podcasts. And that's really like Dr. Cummings, right? Is a perfect example of that. It's like, here's a guy who literally has people flock to his office every week, every day, almost every day for like supervision. And yet there's no audio recordings of him out there. And yet people will like drive 40, 50 minutes to get supervision from him. So it's like, how do I put someone like that who literally has almost half a century of experience in this field in front of everyone's ears, where they have access to it? And it's just like, yeah, if you binge on this, you will become better at Psychopharm within a month. Sometimes people are binging on things. So it's like, Drew, my vision for you would be like, if someone found your podcast 10 years from now and they listened to every single one of your episodes, what would they know and how would they change in that 1 month of their life? And put out the content that creates that change that you want.
I was telling you, I can say it this far into the podcast because we're like 25 minutes in. I don't have a name yet. But part of I've been thinking about this is wanting to help, in some ways with what you're describing, a bit of a revolution. These aren't that mental health and what I've been thinking about is mental fitness. Because for me, mental health, there is this notion that I had to kind of wait to really get into it until I had problems. And that's why we go to psychotherapy, right? Why are you here? It's not usually like, I'm here because I'm really curious about my inner world and it's complicated and I want to get really good at it. It's usually like, I'm really struggling and I don't know. I have a lot of symptoms. And so I think my hope is if people listen to all of the episodes, one, they're going to meet a lot of wonderful, inspiring folks in and around the mental health world, or people who have learned things about their mental health and their journey, as you say, people who have experiences and insights, and trying to really shine light on those. It struck me as you're talking about your podcast that, I feel like you're one of those people that's helped make mental health cool. And I think the idea that finding people like Dr. Cummings, people who have dedicated their career in some ways like selflessly, without a platform, not looking for that, just really being in the very nitty gritty details, really on the very, very front lines of the mental health epidemic, taking care of patients. And to, in some ways it's just great where you sort of see how you're saying, man, that is a cool physician. That is a wise healer. And I really appreciate that. I think it is part of this era in mental health that you and I are really fortunate to be practicing in. Sometimes I think about our colleagues like 1930 and how hard it is sometimes for me to bring up transference or sex or sexuality or money, or and I have a century of people before me who've been thinking about it, talking about it, writing about it. To think about those pioneers like that, like how hard was it for Freud to be like, I think underneath it all, you're not aware. Like it's not in your mind, but I think it's in there because I see it in your dreams and in the way you feel about me. I think you want to have sex with your mother. I mean, how do you say that to somebody with the straight face back then when you're the first person thinking it? It's outrageous, and to think how much. Well, I can't even actually conceive of it, David, what it sort of took to do that. And I feel very fortunate that we have, as everyone says, a lot of shoulders we're standing on.
Well, yeah, and I think Freud was seeing it in the Greek gods. People externalized the taboos onto the Greek gods, the things that they themselves maybe at times wanted to do, or the unconscious taboos. And do I think that everyone wants to have sex with their mother? No, I don't think so. But everyone wants attention and connection, and often didn't have it as much as they wanted. And maybe they want their attention, the mother's attention, over, taking it away from dad, or vying for one of the parents or both of the parents' attention instead of the attention being focused between the parents. So I think like if we kind of move, if we use that language, it makes a lot more sense than like sexuality, because most kids are not thinking about sexuality in the way that an adolescent thinks about sexuality, or like an adult.
Definitely not. And I like that you kind of bring I think that's the kind of cliche version of psychoanalytic thought, and particularly of Freud and Oedipal ideas and complexes, right? And as you just eloquently put, this has a lot to do with attention and attachment, and you can distill it down into a powerful notion of aggression and sex, right? But that actually in the day-to-day lives of how it exists in people's and in their conscious lives, I think being much more explicit of what that is in some ways a representation of, and how it's a really powerful, important idea, right? That, if we got a lot of attention, it often misses the mark, as well-intentioned as we are as parents. Or if we definitely didn't get attention in certain ways, or what I often see is that subtle neglect. You had well-intentioned parents. They just had no idea what they were doing. And we're really kind of awful people, unfortunately. And so, you end up with a set of challenges, struggles, it's like the sequela and aftermath, and everything from your attachments and how you form intimacy to how you build self-esteem.
I could tell you what I'm thinking, but it's very far from what you're saying. But I'll say it.
Tell me what you're thinking. That's okay.
I'm thinking, imagine 5 years from now, a robot in your child's room that can talk to the kid whenever the child doesn't have the attention they want. And the robot is ChatGPT 8.0, right? Like it is like the most sophisticated mind that is child appropriate, but can attune and connect with that child in a way that a child therapist would be able to, right? This is like, I'm thinking of like kids who are raised in poverty, who have neglect now, that is going to be instantly almost replaced with an AI raising the child. How does that change psychology for the next generation? Like, this is something that's going to unfold. We can't stop it. It's going to happen.
I felt it this morning. I've been working with chat, well, just a little bit, in the sense that I've been really struggling to name some things in my life, and that's actually not generally been a big challenge for me. Usually, like with my first book, The Happiness Diet, like the name. Actually, the name was the only thing I had for so long. My wife was like at a party one night. She's like, "You need to either write it or stop talking about it. It's like make the choice." And it's a good advice. It was very helpful. And so, sort of names, witty names, and I've something shifted in me, David. I don't know. I care less about that, especially with this new clinic. It's somehow I'm really very fixated and focused on what I want to deliver and the experience I want patients to have here, much more than what it's called, which is different for me. But I spent the morning. I had a patient not show up, and so I spent the morning kind of, trying to understand a little bit of this relationship, right? How can I understand this tool and use this tool? And I felt I would say a little camaraderie this morning, as I said first, hey, I don't really know how you work, but I want you to kind of get to know who I am. Can you write a biography of me? And it said, I really can't know who you are, but I can write a bio of you. So using this biography and these parameters, can you come up with some ideas for this and some names? And I said, sure, here's can you do 15? Here's 15.
Yeah.
Oh, these are my favorite. I like these. And can you go a little bit in this direction? We're going to be doing some psychedelic medicine, had some like journey vibe in there. And it's like, oh, here's 15 more. And I began to feel, I would say, a transference, something like I see in those sci-fi moons. Everybody's transference are the feelings that we project onto something. So it's like when we meet I don't know, like when Dave and I meet like a silver-haired, wonderfully wise colleague, and she, has been shrinking for, forever, and we have this, kind of notion about her that's our transference, right? Usually a little idealized and hopeful. But I had this transference toward ChatGPT that it would be like those, like in the sci-fi movies, where like like Lost in Space, and they, but they have these robot companions who help them. Oh, well, sir, what do you think of this? And or how about this? And I've been a little nervous about this whole thing, as I think everyone is. But yeah, this morning I felt a little like, like you're gonna maybe help me use my mind a little bit better. And as you're saying, what about when you're young? What about, like our children have grown up with devices and phones and screens. What about for this generation that's going to grow up, and especially a generation that's really in need? And especially to ask that question, right? That like, hey, can you answer some really important questions for me? One of the first things I asked AI was about parenting. I don't know. I was just like asking for tips. Like one of my patients had been has really been focusing on fatherhood, and I really enjoyed that conversation. It's actually one of my questions for here about you, about being a psychiatrist and being a father. I want to make sure and get to. But so I asked ChatGPT. It's like, what are some tips for being a great and like emotionally resonant father? It wasn't like it came up with anything that was profoundly new, but just framing it up, saying, hey, these are 5 things to think about, really stuck in my mind. Even though ChatGPT I don't think is a good dad, right? Just like really make sure in active listening, it's about time. It's like, Dad, it's about time, right? And it doesn't have to be like the most amazing, always perfect, high quality, planned out time. It's about spending time together. It's about active listening. All this stuff that, again, like as a father, but framing it up a little bit, it's always helpful.
I love it. I think the best analogy that I have is the study that was done where they had the best chess player in the world play an AI chess player. And the AI, of course, wins every time, right? But then they pair the best chess player in the world with the AI, and they beat the AI every time. I don't know.
This is the part that I don't quite understand yet is how to interface in that way. Like if the notion of almost like, I know this is a horse out there, but it feels like a wild horse to me. And
that is the art of prompt generation. And my guess is that people who are really good at prompt generation will make will be in careers soon where they can make $200,000 plus a year.
I mean, I think that's already. I think there's no soon. I think that it seems like that
it's
exists,
like here.
and it feels
It's
it feels a
literally
little
here.
strange to me though that they're like, oh, hey, talking to our kids, like, good job out there. Figure out how to ask the big computers good questions and have it do stuff for you. I mean, I appreciate that that's what's coming, but it's fascinating. David, I want to get to all my questions here.
Go.
I realize I don't know how long my podcast is, so I want to hear about your thoughts on the male mental health. I'm going to call it revolution. This notion that
can you define this like male mental health revolution? Like, and who are the heads of this male mental health revolution that you speak of?
Well, I would think define it was first is addressing the inherent questions that come out of modern cultural movements like Me Too, Black Lives Matter, Time's Up, that look at some of the historical ways that masculinity has been within our culture, using primarily the generally thought of masculine traits of aggression, dominance, stoicism as prominent and important male features that should be emphasized. We should not really talk about our feelings. We should be, I joke, I call my wife, I joke, I'm like the man tool, and I'm here to help, here to serve. And I think the male mental health revolution is one acknowledging that has not worked at all for men or for women, or for any a place on the gender spectrum. And in part, the reason is it is a false premise and assumption about the male organism, that we are not, just as our other gendered cohorts, exquisitely sensitive creatures with powerful conscious minds and powerful emotional systems. It denies that when men sit on my couch, they don't sound different than the women on my couch. They don't cry differently. They don't mourn differently. Little tweaks here and there, but it's really what they need, want, crave, desire in general, while there are masculine themes, is very similar. So I think the male mental health revolution is asking us, what is modern masculinity? Can it be a force of good in the world? Because currently it isn't. Just isn't. The majority of robbery, rape, violent crime, homicide, and completed suicide are all male phenomenon, as are mass shootings. Right? So there's something about masculinity that the modern world demands of us, girl dads like you and me. I mean, it can't keep going like it is, right? 25%, I think, of all women are raped. I mean, it's just that this is not a acceptable situation for me, having a lot of people who traditionally has been quite disenfranchised by men that I adore. And I also think there's something about it that it's hard to go on and on here, David, but there's something about masculinity that shuts down creative process and doesn't explore what is great about masculinity. I heard about this recently. I was in a retreat and someone was talking about that real masculine power is actually around being able to set and hold boundaries and create space for people. Well, I was like, oh, that's something I can get behind. That's something that I identify with. I want to allow people a feeling of safety. So as you said, the creativity out of the chaos can come forth. But I think that, and the leaders, I think there are a lot of people who are talking about this. I don't know as much as I like. There are a few people that I think are wonderful leaders of it who are unsung heroes, like Kevin Grunbaum, who has an organization called Love, Dad. And he is part of a group in LA County. They're doing the first ever paternal mental health evaluations, with the notion that, for example, in a house where there is, we're looking at postpartum depression, really, really important public health issue. Obviously, you don't want to take any light away from all of our efforts, but to also note, hey, dad's in the house too. And dad's mental health probably stinks because just had as a new member of his family. His wife is struggling maybe with depression. He has all of those questions that come up. So I think there are other people. I think Kevin Love is often identified, as are some other celebs. I think there are a number of people who've been Carson Daly been open. Carson Daly, I think, has been very open about his anxiety disorder, and have gotten to meet him and talk with him a few times. I think it's folks who've been brave. Think about my colleague, our colleague Greg Scott Brown. We do Friday sessions together for Men's Health Magazine. But Greg, in addition to that, I think is the first ever psychiatrist to have a full page photo of himself in Men's Health Magazine with an article about his personal clinical depression. So when I see, like, I don't think I've ever been really that brave as when I see folks like Greg stepping up and really saying, "Hey, this is the truth." Or Jake Goodman, right? He's a PGY2 resident with like 1 million TikTok followers, but he sort of noted like, "Hey, I'm a medical student, a resident. I got super depressed, and I took some Zoloft or Lexapro," and he took a picture of himself taking his medicine. That was like one of my favorite images in psychiatry last year, because it just, that's something that doctors, medical students, residents, they do every single day. They take medicines to help them with depression and anxiety, but that's not what we think about or talk about, or that we're open about in some way. So I think those are some, I would say that Professor Scott Galloway, Prof G, I see a lot of, he is a marketing professor at NYU, very prominent influencer. He's constantly talking about male mental health, and talking about the plight of young men, talking about setting goals, talking about what he's I saw this great quote about, porn and porn addiction with men. He's like, young men need to realize you need to stop watching porn and stop making bad porn with your, and he's sort of joking a little bit, not that people should make pornography, but that, in engaging in understanding sexuality, sexual intimacy, like kind of doing it yourself as opposed to just passively observing, that's part of those challenges. Or we had a post recently about, you got to do hard things. You got to go, say hi to the person you're attracted to. You've got to stay up late and study and make commitments like that. As you were saying kind of earlier, there is some suffering involved in achieving great things. So, boy, that's a long-winded. That's what it means to me. What's it mean to you? Do you think it's happening? God, it's like, this is like, you have your own podcast. You can't do that on my podcast. Don't ask me questions. I'm supposed to ask you questions, David. Tell me.
Okay. Ooh, I mean, I think we probably started our own therapy journey out of a sense of like, okay, this is what's going to help us be really good at our job, right? Where at least that's where
I started my therapy journey because I was depressed in medical school, filled with angst, and I thought the medical system and doctors were bad. Just thought they were not taking good care of patients. I didn't think the system was organized very well, and I was like, taking guitar lessons and like trading stocks. I was having a hard time fitting in and understand where I was going. But to your point, one of the great things about our field is there's kind of an assumption, right? If you're going to be good at this, being a psychiatrist, being a psychotherapist, you got to do your own work. You can't go read some books and get a certification and hop in with somebody's mental health and do great work until you really, really have a deep sense of the self.
Right. So I think my point is, I think that what happens inevitably is if women are doing more therapy, which they do, than men, and they grow in their EQ and they grow in their sort of self-knowledge, I think that it can be hard for them to find men that have done their own work, who have an understanding of, their shadow. They've integrated their anger into a productive force for good rather than just explosive and disconnecting nothingness.
Just to highlight, would you say a major kind of goal in male mental health would be the sublimation of anger and aggression?
Sublimation makes it seem like it's a no. I would fundamentally disagree with that.
Okay. Tell me your thought.
Here's why. Sublimation is you have a drive, and instead of having a fulfillment of the drive, you take that drive and you push it into something else.
Mm-hmm.
Okay. And I would say fundamentally that's like we should all be, that's a higher order defense. It's a good thing. but there's a drive there for a reason. What is the meaning? What is the purpose of the fundamental drive? And then how do we steer that into something where it gets fulfilled in a way that moves the individual, the family, the society forward all at the same time?
Oh, I really like the notion that like sublimation doesn't address the fact that you're angry to begin with. Doesn't
So,
address
for example,
the fact.
Okay, you're angry. The medical system is not where it should be. People should focus on diet. You should because diet makes a change. Diet actually could prevent illness. Like, why should we focus on the ICU and neglect the preventative health that would shape the next generation to live long and healthy lives?
Let's get specific. I get really mad at school cafeterias, even though I have a lot of respect for school cafeteria workers, because I don't quite understand who decided we should basically try and feed our future generation, right? All of our hopes and dreams, the next generation of brains. Why should we feed them the worst food possible that's cheap as possible? That's a good example. I get pretty angry about that. I think it's unjust. I get like a little aggressive.
Right. So sublimation would be taking that aggression and going to play dodgeball.
No. Sublimation with that is writing a book about mental health and food. That's sublimation. Instead of screaming at cafeteria workers, being this is bad. These French fries are destroying children's brains. Right? I don't like that. That's not a good look.
I would say that's not sublimation, because you are actually moving your anger towards the solving of that issue. So sublimation is
I'm kind of addressing the anger. Like I'm also saying, I really don't want to be in this stance. Is the difference you're sort of noting that in the model I'm giving, I'm engaging in a way that is constructive and trying to process my anger, as opposed to just kind of squirting it out into something else.
Squirting out into something else is a good idea.
It's a defense if, as you say, you're pissed off at this thing and then you go play dodgeball, right? Or you go, wrestle or you go, do something where you get out all that agita.
Which, like, I'm all for exercise and I'm all for, strength training. I do it. But what I'm saying is that you were headed a direction. You realized that your goal was this, right? There was an obstacle towards your goal. Bad cafeteria food. Now, you go to the obstacle and you say, okay, how do I get back towards moving towards the goal? How do I do that? What do I have my power in that to do? If I write a book, it might convince people, theoretically, that this is a bad idea, right? And might move us more towards our goal. So it's like you're using what's in your power, and you help not only your family because you sell books, but you help society, you help other physicians learn, oh, this is important. Let's focus on this, right? And so that's a perfect example in my mind of taking anger and using it in a very sort of masculine, positive way. And not to like say that women can't do that as well, but men have more anger because they have more testosterone.
I think one of the things about mental health we love is that, at least I've always loved that I get to be a little politically neutral in the sense of whether you're Republican, Democrat, Libertarian, like if you have depression, you're my patient. And that's actually above all of that. It's sort of sacred above all of that. And that if you really believe in freedom in America, that having all of the voices in our country be strong is what makes us free and makes us Americans, that we can talk about it. But I want to hear a little bit in your mind. You get into these sort of heated debates. You are there in Florida, where I think there's a lot of different opinions, let's say, and especially when it comes to, let's say, sensitivity about feelings and male feelings.
And I think that, it's I don't mind having, when you're in therapy, I would say the majority of my patients have no clue where I'm at politically. Or where I'm at in a lot of ways, that's just not something that
I think that's sort
across.
Of good work, ideally, right? Ideally, it's sort of a compliment page. I really don't know very much about you. It's not because I want to be secretive. It's just that's it's because we're here to focus on you, right? We're not here to focus on me. So if there's something you need to know that like helps the process, okay, but like it's not so relevant.
Yeah. So I think that with patients, I will try to, if they are on one extreme or the other extreme and it's affecting their mental health, how do we approach that, right? Do we look at cognitive distortions if they're there? Do we, but specifically with like male emotions, I come back to, it can be very hard for men to show emotions because a lot of the times when they do, they get negative feedback, both growing up and as an adult. And that negative feedback keeps them from expressing that, from getting help. I would say the majority of suicides, there's no mental health 6 months prior to the suicide. And
what do you mean by that? There's no mental health, like no mental health problem, or just like no good, like mental health is deteriorating?
no mental health treatment.
No,
like there was a study in England where they looked at a bunch of guys that killed themselves. And the prior 6 months before the suicide attempt, the majority of them had no contact with a mental health professional or a general practitioner. So the majority
and wouldn't tell them if they did. If you go in for annual physical and most guys, you ask them, how you doing? I'm fine, man. I'm fine.
Well, I mean, even I've had professionals that I've seen for 6 months and then they tell me,
oh yeah,
hey, I also struggle with this. I didn't tell you. So I think females and males are often guarded about the severity of their internal world. And I think men may not feel that there's a place or a context for that. And I think that it's just probably in the last like 10 years that therapy is becoming much more normalized, where I imagine most men would have like less stigma in going to see a therapist. Like a couple of my, lifting buddies, guys who are not in the therapy world, they've seen therapists. And these are guys who like can deadlift 400 pounds. These are like not your average person that you would imagine going to a therapist. So I think there is a shift in our culture that is good in that direction, right? And I'm focusing on going to therapy because I do think a lot of the work is psychological work, and you can't learn it in a self-help book.
Well, I think there's that, but also, I think you're differentiating a little bit between, a mental health model that's just meds, as opposed to meds are one of the tools, but one of the main utilities of medications for us is that it allows individuals to achieve a level of mental health to engage in deep psychotherapy. Now, if you are so profoundly depressed and suicidal, you can't do a certain type of psychotherapeutic self-knowledge exploratory work, right? Because your life is on the line, right? We're needing to really think very, very supportively, structurally, safety-wise. So exploring things that happen to you, exploring ideas, dreams, fantasies you have. It's really, not possible. I don't think you're going to solve my problem of having not a more sophisticated answer to people like Andrew Tate than anger. And I think the one thought I had about that is maybe it's okay if I don't have anything other than anger and violence because he's evil. That actually he's a true force of evil. He's beyond, sort of beyond us postulating or even formulating or thinking about what it means from a kind of conscious or unconscious perspective, because it's just a force of evil. It's a person who wants to destroy other lives with no notion of the consequence of his actions or the influence and all of the pain that it causes to espouse views like he does.
Well, I think that there's a couple things that we can do. And I think in the podcast, I talk about psychopathy, both male and female psychopathy, because I think that a lot of the times we can lump people who have been hurt by men, they lump more men that are more psychopathically oriented.
And can you define that a little bit just for everybody listening? What is psychopathy?
Psychopathy is like like, so in the DSM, it's antisocial personality disorder, but I like psychopathy better because it seems to be more biologically, genetically constructed with specifically low affective empathy. So someone who's very, very high in psychopathy, they see people as cockroaches. They don't see people as humans. It's about 2% of men, 1% of women, and it's across all cultures, right? So there's the vast majority of people that rape are psychopaths. The vast majority of people that are like mass murderers are psychopaths. You're much more prone to try to succeed with violent, predatory means if you're a psychopath.
And what's missing in these individuals, like in their mind? I mean, we talk about like narcissism, you don't have empathy, but what's at the core of it?
So there's two types of empathy. There's cognitive empathy and there's affective empathy. Affective empathy is the ability to feel into someone else's mind. Cognitive empathy is the ability to put words to what someone else might be feeling or thinking. So someone who's a narcissist could have a very good cognitive empathy and who had some psychopathy, right? Because it's this psychopathy in the narcissism that is the low affective empathy. Okay, so the psychopathy, you can have the dark triad, which is Machiavellianism, psychopathy, and narcissism. That's the dark triad.
No, to break this down, this dark triad. This is where's this idea come from?
Oh, it's out there. I mean, if you Google what the dark triad, but I talk about it in some of my episodes, especially like Ted Bundy. We talk about the dark triad. Machiavellianism came from the book, right? And about political movements or like lying and manipulating, moving yourself forward politically by doing things that are nefarious for the gains of achieving power. So that's
Man,
Machiavelli.
I'm glad we don't see that kind of stuff anymore, David.
Yeah, right. So Machiavellianism is like a very sort of strategic manipulativeness that could move yourself forward. And it just so happens that people who are more Machiavellian probably are more narcissistic and psychopathic, right? So psychopathic, low affective empathy. If you want to see a really good dark triad character, watch House of Cards, right? He is like total dark triad. So psychopathy, low affective empathy, predatory aggression, right? So not impulsive aggression, but predatory aggression. If you watch House of Cards, the way he takes down people, it's like he's thinking like a chessboard. It's like 20 steps and he's thinking way ahead of people. That is that predatory aggression.
And just so I want to highlight this, the cognitive empathy means that as a psychopath, I can see the other players on the board and kind of have empathy for what they're thinking. Oh, so-and-so is definitely wanting to get this job or get this appointment. Whereas the difference, the affective empathy, is that I feel it. That I feel if I destroy this person's career, I'm going to feel bad about it. It's going to feel icky. I feel that, if I accost this person or squash them or whatever, these dark triad psychopaths do, that it's going to stick with me. It's going to bother me. And that they're lacking that. They don't actually have that sense of remorse, that sense of like, I don't know, being in trouble with mom or someone or society or viewed in a certain way by society. That doesn't bother them. They don't think about that.
They don't have guilt like normal people have guilt. They don't have fear like normal people have fear.
Is that why men sometimes are attracted to them? Is there that fantasy that living without fear or guilt is I'd really be liberated?
Okay, let me say this interesting caveat about Ted Bundy. So when Ted Bundy was young, he was at this like camp when he's like a kid, and he spends all of his day building a hole and putting spikes on the bottom of the hole. Okay, like he already had that predatory like aggression, right? And he was described in his like adolescence as this super awkward, super hard to connect, almost sounded autistic. And someone who's psychopathic, they can seem autistic in some ways, because they don't have that affective empathy, so they have a hard time connecting with people. But they can learn it secondarily, and they can get that cognitive empathy later on by watching people, by observing them, by reading books, blah blah blah. Right? So And my whole point in this is someone with the dark triad is someone that we need to protect the culture from, right? And so by talking about psychopathy, like I do on my podcast a number of times, it's to protect the therapist. Because if the therapist wants to believe that everyone is thinking exactly like their brain thinks, right? Empathic and warm, and, and the psychopath is just a different brain. And if you don't realize that that person exists and that they're very different than your brain, you're going to get burned. Everyone gets burned in their life by malevolence. Everyone.
That point you make about understanding how individuals' brains and minds work differently than your own is something that I really got almost like smacked in the face with in training. I remember it hitting me. I don't remember the specific clinical experience, but I remember sitting with a patient and just being like, the real challenge in this profession is to not kind of go through on the tracks of what we think how a mind works, and instead really kind of almost open yourself to wandering in the desert and trying to understand how this one works and how it actually is explicitly unique and different, especially than yours. And I think that's it's such a challenging thing to do, because there's that assumption. We have that assumption, right? You and I both have a little dyslexia and maybe appear more organized than we are, and are both psychiatrists and dads, right? There's that assumption of like, wow, we must really think similar, get each other. And I think that, there's some truth to that, certainly, but it's definitely mostly not, I would say.
Running the big five on people has been helpful for me. So this is like when sometimes with the podcast, I'll do a deep dive on a topic that I want to learn well. And so the big five was one of those. And then I run it on most of my patients. So I run the Neo PR, which is the gold standard. It's like,
I don't think people know what the big five is. Can you tell us a little bit about that?
So extroversion, it's like gregariousness, outgoing, neuroticism, how stress reactive you are, how reactive you are to stress, agreeableness versus disagreeableness. So how, this is part of that affective empathy piece, I think, where it's like how trusting.
Agreeableness is like how much I kind of get along with people, and how much I kind of, can blend in and fit in a group.
Agreeableness is like how likely are you to argue? How likely are you to enjoy confrontation? How likely are you to, jump into trusting someone or not trusting someone? So if you're very trusting, you're probably higher in agreeableness. Okay. So you got neuroticism, stress reactivity. You have, which I actually really like to diagnose someone as high neuroticism versus like borderline personality disorder or a lot of other personality stuff, because it makes sense to me. But
it sounds somewhat refreshing. It's like, how was therapy today? It's like, babe was pretty good. He told me I had high neuroticism. It's like, sounds kind of, I don't mind that.
Stress reactivity. You are an individual who's highly stress reactive, or you're not, and then there's extroversion, right? So we talked about that: warmth, gregariousness, assertiveness, activity, excitement seeking. So you're higher. I would say you're higher extroversion. You're going to all the conferences. You're meeting people. You're putting yourself out there, right? I would say you're lower neuroticism. My guess, maybe average, but maybe some aspects learn lower. Then openness. I think you're very high openness. So openness is like fantasy, aesthetics, feelings, actions, ideas, values. So it's like, if you're high openness, you're willing to explore other ideas, keep your options open.
I would even say I'm tickled by openness. I think the notion of, at least when I'm at my best, it's something I notice when I'm not doing well, is that I start to definitely get more closed. I get more in that kind of, I get a real kick out of people, creativity, emotions, nature, food, all that stuff. But I notice when my, I don't know, neuroticism is a little higher, or depression's a little worse, or, that's one of the things I notice really. It's sort of painful that it slips, right? Because you go from having experienced and been in that stance, which is like, wow, like the juju's flowing, to like, ugh.
Yep. And then agreeableness. And then the last one is conscientiousness. So I mentioned this about you. I think you're high conscientiousness. So high conscientiousness is like competence, order, dutifulness, achievement, striving, self-discipline, deliberation. right? Those are the domains of conscientiousness. So for you, I see you as like at least 3 standard deviations above the mean for achievement striving. And so you can't help but be like just moving forward. How do I move forward? How do I like keep progressing? How do I like, what's the next book I'm going to write? What's the next thing? And it's beautiful. It's a beautiful thing. So I would say like that's not necessarily, I think earlier you said putting yourself out there in the public is narcissism. I would say it's achievement striving. It's a conscientiousness subdomain often.
Well, I think I said I worry. I was saying, I think suggesting I'm worried that that we were talking about sort of some of the barriers that have caused mental health to be mysterious, hidden, elusive, hierarchical. So I think that's that kind of more traditional notion. But I do well on your big 5, David. I think I'd like being your patient. I come in, I hear I've got this cool.
No. I didn't say you were high neuroticism.
3 standard deviations above something. You didn't say that's what I heard. That's what I heard, doctor. No, you didn't say that.
Now I think you're high neuroticism.
You said everybody gets diagnosed with high neuroticism just like you. That's not what you said. Okay.
No. I think
my fault.
We have to.
We don't have to wrap it up too soon because I have 2 more things. But I wanted to finish this up. The big 5. So the big 5, and I want to. Okay, then we're going to do 3 things. I want you to. The big 5 is a way that we can think about ourselves. And so I want people to sort of sit with those big 5 ideas and think about yourself a little bit. I have 2 other domains I want to ask you about. One is about fatherhood. And I know that's a big question, but I just want a couple minutes from you on fatherhood and how you navigate being really curious about the mind and the inner workings of people. And at the same time, understanding like our kids are a little different. And their minds aren't available to us in some ways in that way.
Okay, here's my 2 cents on fatherhood. If you're a professional, the books that I really enjoyed were Ed Tronick. He does a nice book on the still face experiment. It's like very dense. And I like Beatrice Beebe on attachment. It's very dense. But the reason why I like those 2 books and the ideas that come from that is you can connect with a pre-verbal child in powerful ways before they even say a word. And I think that one of the things that culture has wrong about parenting is they think attachment parenting is like co-sleeping, holding your child, and these things that like the attachment interview, the attachment research has never said. These are things that like were ideas of people that got packaged under a certain word that was a popular word, attachment, right? We all want to attach with our child. Real attachment is playful engagement with your child that is not necessarily verbal. And so it's presence, it's playfulness, it's like interacting, it's mirroring. That is, and that is the foundation of attachment.
David, that's so helpful for me because we're so explicitly verbal about emotions, feelings, right? Because I sit down with people and say, tell me about the week. And they tell me like all the good stuff, right? The joys, the pain, the triumphs, right? And it just comes out. And there's something that's really helpful to me of thinking, that's not in any way how it sounds like in fatherhood, which like I kind of know consciously somewhere, but it gets elusive to me, but also that it kind of looks, sounds, and feels very, very different because it's a non-verbal attachment endeavor for a lot of it. And I think that's a really, the notion that where you see me as a dad is at the dinner table and the breakfast table, right? And that if I'm just there listening, that's sort of putting points on the attachment board. All right, last question, David. Thank you so much for that. And then you have started painting. I don't know whether you've always painted, but I really loved watching you be vulnerable and open about your pleasure as an artist. And I just wondered if you could share a little bit about that before we have to go, because you have to get back to the front lines and take care of an individual here.
This is actually one of my paintings right here. If you're on YouTube, you can see it.
Yeah. Can you tell us a little bit about it?
It's my new style. It evolved with like parenting, right? But it's reflective paper, and I use some gold, and then I pour epoxy on top of it. And so it is like my like I don't think anyone used this style before me. And if you change orientation, the colors change because of the holographic paper. So I don't know. I just like I think it's always been in me to do artistic stuff, and I'm just like, let's go, with my kids. I mean, my daughter and my son really like art. And so it's a way of connecting with them. We're pouring the epoxy together. We're putting on the reflective paper together, and it's fun.
Meaning you like blank, when you think about Saturday morning, it's like you're painting with the kids. Or Saturday afternoon. There's some place you do block out like art time with the kids, and you look forward to that, like a workout or like a reading time.
It's like it's when we're into something, we're really into it, and that's the way my brain works. So it's not like I'm not planning. It's just you show up and you start doing it.
David, thank you so much. It's a real treat to get to speak with you and to hear so much about your life, your mind, how you think about psychiatry. I'm sure I'm going to have you back on. Thanks for being a friend, and thanks for being an inspiring psychiatrist. And thank you for all the kind things that you've said and all the just really wonderful information and tips that you've shared. When I think about everything we've covered, it's just been a delightful conversation, man. And I look forward to continuing marching arm in arm with you in this fight to improve mental health and to improve self-compassion and improve the world we live in. It's a real treat to be with you on that journey, my friend. And I'll see you really soon. Everybody, thanks so much for joining us for another episode, and see you on the next one.